Anyway, before starting the conversation, I thought we've agreed to have like a very short introduction of the book, which I will be doing, about 10 minutes. But then before that, I would like to introduce my co-authors, as well as our esteemed moderator, who joins us from the tropics, Kåre Moen. First, I would like to introduce Kristin Heggen, who is a professor at the Faculty of Medicine, also the director of the newly started, or pretty new started, Center for Sustainable Healthcare Education here at the University of Oslo. And Kristin has been one of the co-authors on this book, and you will hear more from her once this discussion starts. And then the second co-author is Eivind Engebretsen, who's also a professor and also connected to the Center for Sustainable Healthcare Education, who's been part of this publication. And then myself, Tony Sandset, I'm a researcher at the same center again, Center for Sustainable Healthcare Education, here at the Faculty of Medicine. And the two of us have published this book, and we're very happy with the result, and also that all of you want to join us. And then I guess I will introduce our moderator and the man who will take us through and ask us both critical and I guess illuminating questions, Professor Kåre Moen at the Institute of Health and Community, or Community Health, I guess it's called now, and who is a medical anthropologist and an MD. And who will be joining us in our conversation and lead us through the conversation. I will give a very, very brief introduction to the book, which will just run through some of the main points and some of the more like very, I guess, mundane and perhaps even trivial parts of the book before we get into the more the substantial discussions that we'll have. First of all, I can show you the book, I guess. Oh, with my filter, I can't. I have like this filter, but I can put it out on a link. So the book is called Sustainable Sexual Health, Analyzing the Implementation of the SDGs. And it's a pretty short book. It's about 120 pages with 5 chapters, which we wrote it in a fashion where you can read each chapter as a standalone case that has to do with the combination of sustainability and sexual health. So the book is intended for a broad readership of people who are interested in sexual health, but also in sustainable health or sustainable, the SDGs, the UN's SDGs, but also sustainable development. And in the book, we try to map the genealogy of the terms sustainability, but also the genealogy of sexual health, and that is the history of both of these terms. And we argue that there's a deeper link to these two terms than just the UN's SDGs, and that the current connection made between sustainability and sexual health goes further than just the UN's Sustainable Development Goals. So the 2 first chapters are pretty brief or abridged histories of sustainable development and sustainability as concepts. So that's one of the reasons why we started this book project, is because we started to think that there might be a deeper connection between sustainability thinking and sexual health. And in the 2 first chapters, we try to map out this linkage or this association through history. And then after our initial analysis of sustainable development and sustainability thinking, and then sexual health as it has developed, we offer 3 case studies that has to do with sexual health. The first is an analysis of sexual health strategy plans from different European countries. As many of you might know, there's been an influx of sexual health strategy plans across European countries, but also across the globe after the SDGs, and even before the SDGs were launched. So in these 3 case studies, which 2 of them deal with the HIV epidemic, and one of them deals with the aforementioned sexual health strategies, we try to map out how sustainability thinking are linked to sexual health strategies and, for instance, HIV strategies, but also how to think about more nuanced the concept of sustainability when it comes to sexual health. And as many of you already know, the UN's SDGs and the SDGs themselves might not have a specific target for sexual health. The SDGs have several sub-targets that deal with different aspects of sexual health. For instance, target 3.3 states that we will end the AIDS epidemic within 2030, and there's different sub-targets that deal with reproduction and reproductive health. So in our book, we have operated with a rather broad concept of sexual health, which covers also reproductive health, which is in line with current newer versions of definitions from the WHO and other organizations, where reproductive health kind of is included under the umbrella of reproductive health. As we may say, all reproductive health is sexual health, but not all sexual health is reproductive in nature. So the book is also intended for people who are interested in reproductive health, but conceived more broadly. And sexual health, as I noted, is a term that is also linked to sustainability thinking through the focus on sexual rights, which in turn is also connected to gender equality and to deeper human rights aspects. And as such, the connection between sexual health, sustainability is kind of circular in the sense that it also encompensates more aspects of the SDGs than just what we traditionally think about when we think about sexual health, for instance, HIV or infectious diseases, and then reproductive health. So the book also covers a rather broad thinking of sexual health, but also broad thinking of what sustainability can be thought of. So I think we could say that while the SDGs are sort of used as a canvas to tell a story, we're perhaps more interested in the term sustainability than we are in tracking progress towards the SDGs. While progress towards the SDGs is important, I think this book is more aiming to think more deeply about sustainability rather than just SDGs. So while the progress towards reaching different sexual health goals of the SDGs are important, we also wanted to tell a story of sustainability and how the very concept becomes entangled pretty early on with sexual health, and in particular in terms of reproduction and fertility rates. Case in point here would be probably going back to Malthus and the idea of reproduction as a threat to, for instance, sustainable population management, which has been a recurring theme, as many of you know, and still crop up from time to time in sustainability thinking. So this case studies in the book focus perhaps to a large degree on the case of HIV, which is probably a result of the authors and me in particular, but it is also a product of the place that HIV has in both the UN system, the broader history of epidemics, as well as how HIV still is a pandemic of pretty significant proportions. However, we also tried to make the book in such a way that each case is a standalone case study, as I said. And even within the chapters that deal with HIV specifically, we've tried to more so focus on sustainability thinking within HIV efforts, so that people who might be interested in other empirical topics can read something out of our case studies that has to do with sustainability. So by focusing on the connections between sustainability thinking and sexual health, I personally think that the book can tell us something more general about the current historical moment in terms of how we think about health, responsibility, risk, and visibility. I think in the book, we've tried as best we can to show that with the introduction of sustainability thinking into healthcare, new ways of thinking about health has become visible, The same about how we think about responsibility and also risks. And then which populations are being made visible in different situations when it comes to sexual health. I'll actually conclude my very brief foray into this, and then we can start. I guess Kåre will start us off with some questions, and then at the end of the discussion or a conversation that we will have with Kåre, we will open the floor for some Q&As with the rest of you.
Thank you, Tony. That was a nice introduction, and hello, everyone. I'm joining you from the tropics, as you said, Tony. I'm in Dar es Salaam in Tanzania. Much of my work these days is taking place right here. I'm working on 3 different projects, and all of them can be said to have something to do with sexual health and sustainability. So I had been looking very much forward to reading your book. Thank you for giving me the opportunity to read it and now to discuss it with you. The projects I'm working on, just to mention that briefly, one of them is a research project looking into issues pertaining to access to healthcare in key populations, outgroups in Tanzania. A second is looking at various aspects of PrEP programming, HIV prevention, biomedical HIV prevention programming in Tanzania. And the third is a project that deals with doctoral education in Tanzania. So all of them, I guess, would need to be sustainable projects. And in terms of themes, many of them touch on to sexual health as well. So, and also actually on a personal level, only the other day here in Dar es Salaam, an acquaintance of me, a gay man about my age, there was a burial for him, so I took part in that. He had been living with HIV for quite some time and died from complications, HIV-related complications. So in this city, HIV is still a disease that people die from. It has been such for a long time, and I am afraid it will continue to be such for quite some time to come as well. Yeah, so I took a great deal of interest in reading your book. And first of all, congratulations. I think for most of us, even considering the work of writing a book is quite impressive. Those of us who mostly write papers, we think that that could be quite some work, but a whole book, that is even more work, right? I don't know, in this group, in this room, I guess, since it's a book launch, most of you might not have had the chance to read the book. When was it actually available, Tony? Has it been available for some time?
December, yeah.
Yeah, so you have started to receive sales figures then by now. So, and I think there is in the chat, someone has posted a link to a place where one can buy the book. Can it be bought also in a printed version somewhere in Oslo, or is that not possible?
I think you can. That would have to be ordered, I guess, like Academica and other bookstores. They would be able to order it for you, but I don't think it's in a bookstore physically right now.
Okay, and maybe it's in the library.
It's on its way.
It's on its way to the library. Yeah. So anyway, we can get access to it if we want to, and I hope by the end of our conversation that the people in this room will understand why they should read the book. So congratulations on the book itself, but also congratulations on coining an entirely new term. Sustainable sexual health. I have tried to Google it, and if I'm not mistaken, if you Google it in Google Scholar, you will find that exact combination of words mentioned only 35 times in the history of the world. And so now you have, I think that's, and not only that, those 35 times, except for those that pertain to you, they're the adjective of sustainable pertain to something else than sexual health, typically services. So sustainable sexual health services. But in your case, that's different, because in your case, you are talking about sustainable sexual health itself, I think. And my first question to you guys is, how did this term come around, and what do you take it to mean?
Does anybody want to start?
Yes.
Or?
You seem like
Maybe
a good
I
candidate.
can start. Yeah.
Oh yeah, Kristin, go ahead.
First of all, I have immensely enjoyed being part of our group of authors, because it has offered us a possibility of discussing very important topics related to, of course, the development of our Center for Sustainable Healthcare Education. And of course, I have this, since we are a center and developing the center, I have this very keen interest in the concept of sustainability and the SDGs, but I also have sincere concerns about sustainability as a buzzword, as a slogan. So this is one reason why I find it of great value to uncover some of the tensions and paradoxes that have emerged in the age of the SDGs. That's really one of my strong interests in this book, and Eivind will later on talk more about the paradoxes. If I can just have a few more comments to this part of the book, which I find extremely interesting. As all of us know, probably, the United Nations have officially adopted this 2030 agenda. It's 193 states, and with a title that the agenda has the title Transforming Our World. And with these 17 development goals, which is said to be a roadmap to end global poverty and leaving no one behind. So it is a consensus-driven agenda, and the book is following the journey from a global agenda to implementation in local settings. So we use this reproductive sexual health as more of a case that we are analyzing. And our analysis of interventions in the name of sustainability activates key issues like power and authority, freedom and responsibility. And we sort of try to map the relationship between the individual, the national and the global actors. So in sexual health, reproductive health, there are tensions, dilemmas and conflicts, which are especially contested for, because here, as we see it, health policy meets personal moral standards. You bring in gender concerns, as well as structural religious norms in tension with this official policy. So we could sort of call it macro-micro movements. And one could say that in the book that sexual and reproductive health is treated as a case, as Tony mentioned. So it is a case study where we are exploring how the state and the subject stand in relation to each other. So I think this book has a huge potential to contribute to a more nuanced and critically informed reading of how the SDGs are implemented.
Can I?
Using this, yeah.
Can I
Yes,
just follow up a little bit? Because I think it's a brilliant, actually, it's a very, I mean, natural, but also a very good question. What do we mean by sustainable sexual health? But because I don't think we define it in the book, and I would say deliberately, because I would say that actually this book is in a sense, or the term, the concept or term of sustainable sexual health is in a sense a kind of conceptual experiment that we put concepts together that are not which makes us, I think it makes us think in a sense, and what it makes us think about is exactly those conflicts that I think that Kristin also touched upon, between the political, between globally defined policies like the SDGs on the one hand, and on the other hand, the intimate sphere of the individual. I mean, sexual health is a kind of a symbol of the intimate sphere of the individual. So something very personal, very private in a sense, and on the other hand, something very public. And what you say, we would more easily talk about sustainable sexual health services or sustainable institutions. And by talking about sustainable sexual health and not adding institutions, we are saying in a sense that also we're implying that sexual health has something to do with politics, of course. And we are in a sense revealing that there is a tension here between, and also to make something sustainable is to, in a sense, is to manipulate it, to do something from the outside, to intervene in it from the outside, in a sense. And I think that all these conflicts are something that we want to draw attention to through our book. And that is where I think also sexual health is a case. It's not a book about sexual health, but it's a book about, I would say it is a critical reading of the Sustainable Development Goals. And we're doing a critical reading of the Sustainable Development Goals by using sexual health as a topos, or as a case to where these dilemmas or paradoxes are played out, in a sense.
Absolutely. And so when you say it's a concept, it's a term that might make us think, might help us think, that would seem to mean that it's a concept that could have analytical potential. Could this become an analytical concept, or is it already?
Yes, well, I think it's, I haven't thought about it as an analytical concept, actually. I thought about it more like a kind of, like I said, a kind of conceptual experiment. We are making, we are joining two terms together, and that makes us wonder. So in that sense, it's analytical. I think it might open up some new perspectives. So, but it isn't an analytical concept in the sense that it is a concept that you can draw a hypothesis from, or it's not that kind of an analytical concept. But I think it might be an analytical concept in the sense that it makes us wonder. It is thinking. Julia Kristeva says is thinking, talks about thinking as disclosure. And I think it's that kind of concept, that it discloses something that we normally perhaps take for granted. So that it might be in that sense.
Yeah, I think Tony would like to add something there.
Yeah, I just wanted to. I think I agree completely with Eivind, and I think for me, working with the concept, I think it's more of a provocation in a sense, a way of making people think. In healthcare, we have all kinds of compound words, right? Sexual health itself is a compound word between sexual and health. What happens when you combine these two words, but also what happens when you add a third word, sustainable? Because as Kristin said, sustainability and sustainable are becoming more and more like buzzwords. You add them to different concepts and they suddenly take on different meanings. And in doing so, I think for me at least, I think like Eivind said, it's not as much of an analytic or even a normative concept where we can say that the sustainable health or sustainable sexual health can be this or that. I think it's more of a way of provoking thought and critical thinking of both sustainability, but also sexual health, obviously, in a sense.
Yeah, Kristin, I think you also wanted to add something there.
Yeah. I think it's an interesting comment, whether or not this is an analytical concept. From my perspective, I think we open up the concept through our analysis. And then we make sort of visible the tensions, the dilemmas, which is connected to the concept. Mm-hmm. I wouldn't say initially that it is an analytical concept in itself, but we open up the concept of sustainability.
Yeah, thank you, Kristin, for that keyword, sustainability. Because one of the things you do, and I think you have done it previously as well, with the three of you, both together and independently, you've been, exploring the concept of sustainability. And one of the concerning things in the context of sexual health, I think, is that you described that there has been a shift in the way that sustainability is understood. And could you just briefly take us through what is this shift and what is the concern for sexual health?
Would you start, Tony?
Yeah, I mean, can I start in the other end, and then I guess Eivind can tack on for the last part, because I think my contribution to that would be to start what. So in my mind, I think the shift in sustainability has become where we become responsibilized in a sense. We become, at its worst, I think sustainability thinking becomes a way of individualizing responsibility instead of looking at structures, right? So if we say that to make some, like Eivind said, sustainability and sustainable, anything that's supposed to be made sustainable is also the subject of manipulation. Something has to come from the outside and make something else sustainable. And I think in the topic or in the case of sexual health, I think there's a danger, and in particular maybe in the case of HIV, which you also know very well, Kåre, there's a lot of good things happening, but there's also perhaps a turn towards individual responsibility being where we say like, okay, something has to be made sustainable, that has to go through individual behavioral changes rather than structural changes. And I think that is probably the more darker side of sustainable thinking, where sustainability becomes individualized responsibility for health, or in this case, sexual health. And I guess Eivind can also tack on, or Kristin tack on to this.
Yeah, I think you point to the important transition that we try to emphasize, and that we have also emphasized elsewhere. Actually, kind of a shift in concept from sustainability understood from the, I mean, we could start this history further back also, but if we start in the Brundtland Commission from 1987, I think that sustainability is mainly understood as durability. And it's also, I mean, translated as durability in several other languages, like développement durable in French, for instance. So, but later on, and we have also explored this in development discourses, we can see that there is a kind of a biopolitical turn in the concept of sustainability, becoming more self-assistance. So going from being durable to being able to be self-assistant or take care of yourself, and by through this shift, also, I mean, there is a shift from sustainability being a goal to becoming a criterion for assistance in diverse discourses. So, I mean, in development aid, if you are not already considered sustainable, Paul Farmer has written extensively about this also. If you are not already sustainable, you are not worthy of assistance, in a sense. So, and I mean, this is, we are, and that is actually a very important aim of our book. This is not a kind of an enlightenment process, project trying to defend the great promise of the Sustainable Development Goals. At least not only. It is a critical reading. It's a kind. The aim is to question that concept, and also to turn to the texts and to the Agenda 2030 in itself, and look at some of the tensions inherent in the concepts and the agenda. And one of the, if I might add, one of the most important tensions in that agenda is also what we name a paradox of authority. And here we're also we're looking at the we, and the people, the subject talking in the agenda, because there are two, in a sense, two different we's. We, the people, promising we, and then another we, a broader we, that has the obligation to keep that promise. And the whole rhetoric of the agenda is built on switching between these two different we's, between the we giving a promise and the we that in a sense obliged to keep that promise. And I think that is a very interesting tension that we find in many different discourses now, also in, I mean, public health discourses, also. Who is committed to keep the promise in public health? Who is the we giving the promise, and who is the we that is suspect? I mean, the Norwegian Prime Minister, she's talking about we all the time in public health, and there is, I mean, there is much rhetorical power in this, in blurring the distinction between the we giving a promise and the we that is bound by that promise.
So with this exploration of sustainability, the concept, the way it has evolved, among you, the authors, have you sometimes thought that maybe the SDGs should not have had sustainability in the title?
Are you then talking about United Nations 2030 agenda, or yeah? I think, as I said introduction here, that I think it is a complicated roadmap that the globe is faced with, because of this very consensus-driven agenda. So I think it's hard to say that sustainability should be left out because it has been such a strong and influential concept since it was launched by Gro Harlem Brundtland. But I think it is a complicated concept, and to lead the road map for us is very consensus driven, as I said, and in that way we need a book which could be a critical reading of the concept. So I think that's probably my best answer to it.
Yeah, yeah, go on, Eivind.
No, just saying that I'm definitely in favor of sustainable development. I mean, who wouldn't be? I mean, it's like equality or empowerment or evidence, or I mean, all these, or democracy, all these words. It's impossible to be against. And I think that the concept has great promise. But like all the other concepts that I listed, they are only, I mean, productive if we continuously explore them and think critically about them. And I think that what might be, to me, interesting with the concept of sustainable development is that I mean, development is not better than sustainable development. At least sustainable development has the potential for challenging the whole Enlightenment tradition and a very naive concept of development by introducing a limit, introducing an inner limit to that same development. So sustainable development is kind of both it contains both a promise and also a limit or a question of that same promise. So it's both modern and postmodern at the same time, and that is very, very, very interesting. Potentially, that, I mean, sustainable development might be a very, very interesting analytical concept, but currently it isn't. It is only a buzzword. And I think that is by exploring and by trying to narrowing down what might this concept be and what might it mean and what consequences might it have in different, for instance, in sexual health. It is by doing that kind of endeavor that we try to do in this book that I think the concept might be very, very productive.
So moving now from sustainability and your exploration of that to sexual health, because you also unpack sexual health and you trace it through time, and you trace it through current strategies in Europe. So is it possible to very briefly say something about what sexual health seems to mean at the moment and what is left out of sexual health as a concept?
I guess I can answer that. So briefly stated, I think what sexual health started out with in the 70s, when you first look at it, or maybe even late 60s, but definitely in the 70s, you see a more focus on pathology and disease prevention, which it's obviously once it becomes even more acute in the 80s with the HIV epidemic. That's when sexual health truly really takes a turn towards pathology and focus on limiting sexual transmitted infections. But as time goes by and through different modalities, for instance, oral contraception, women's liberation, and also the rise of LGBTQI movements, we now see that sexual health has become, as with sustainability, it has become a rather large, a term that can capture a broad range of things. And now we see that it has to do with human rights, it has to do with individual rights, as is thought with like the idea of sexual rights, which obviously is a term that still is contested some places globally. But the term sexual health has now come to mean much more so than just disease and infirmary, right? It's no longer just the prevention of sexual transmitted infections or dysfunction. But one of the things that I find interesting and is obviously that in that if you look at the way that the term has evolved, one thing that is obvious, or is very obvious in the various strategies, is that, for instance, pleasure, desire, and joy is totally left out of these definitions. Sexual health is, I can't remember the name of the article, but it's a wonderful article on sexual health in research, and the authors, through a very nuanced literature review, show us that, and as we do in the book, that pleasure and joy and all of these like more emotive things that has to do with sexuality is totally left out. So the term is still not broad enough to encompass pleasure, for instance, as a term that is part of sexual health. Even though they use terms like well-being and holistic, pleasure is almost never mentioned, nor is desire. So that's kind of what's left out.
And isn't that also an aspect of what we were talking about when discussing the concept of sustainable sexual health, that it's something that is handled in a sense? It becomes something instrumental, something that is handled from the outside. And in a sense that is very reductive understanding that might grow from that.
Yeah, and can I just add to that I think also what Eivind is pointing to is interesting also, because what Eivind is pointing to is also the fact that pleasure, for instance, is hard to quantify, whereas a lot of other things can be quantified through targets, through metrics, etc. So I think that's an important point, that all of these more emotive aspects of sexual health is being left out, because they're seen as, one, they're seen as personal, but two, they're also hard to quantify. So yeah.
So when I was reading your critique of the concept, living out feelings, living out pleasure, love, what have you, the whole emotive universe around sex, I also kind of asked myself, are you sure you want it in there? Do you want a sustainable sexuality?
I mean, that's a good question. So are you saying that if we've incorporated pleasure and desire, it would be kind of instrumentalized, or?
I think one of your critiques is that, you know, when you look at the SDGs, that a lot of it has to do with counting and goal setting and reaching, you know, goals. And so it's one of the things that happened to sexual health, as you so well explain. And I just wondered if there could be a danger that could happen to sex itself.
Yeah, I
guess
think
you're probably right about that. I think it is an intriguing comment from you, Kåre. I had in mind kind of different aspect, because what, from my perspective, has been very interesting is when we are talking about sexual or reproductive health, is that we are invited to think about health as a very broad concept. And I think that's been something when we go back to the Sustainable Development Goal, viewing health as one goal, it's not enough. We have to broaden it out and see how health, sexual health, is treated, or we have to view sexual health as in a very broad context, where we in the book illustrates that it has to do with moral norms, religion, gender norms, etc. And health is of course also impacted by climate change, by human rights, by economy, social justice, everything. So focusing on sexual health, as we do in the book, also invites us to see health in a very, very broad perspective, which I think is very useful.